I'm JB, sales manager in Excobio. Thank you all for taking time out of your valuable, especially weekend time, to join us today. We'll be learning about exosomes, specifically Excobio's exosome, as well as the science and technology behind them and their clinical application, of course, from Dr. Elina. And First lecture was to be conducted by Mr. Byung, the CEO and CTO of Excobio. After, but as though he mentioned, he is now doing an important investor meeting, so I have to give a presentation on behalf of him. But by using his presentation, maybe I can deliver the same message with him. And after a 20 minutes opening lecture, we will have a second presentation by Dr. Elina, a dermatologist from Greece. And once all the presentations are complete, we will have an interactive Q&A session. So feel free to ask any questions and engage in open discussion, please. So, okay, let's begin. So we have three main products for skin, hair, and intimate area. So, Mr. Joe, he is the CEO and CTO of Excobio, and he have been doing a lot of presentation in many international congress around the world. So we created this 10 question to ask an exosome innovator. The main reason why we create this question is that to deliver the right message to international doctor and our partner, to let them gain ability to distinguish which exosome product or which exosome companies are qualified enough to bring their clinical practices. So number one is investments. We Excobio have been investing more than $80 million from 2017. And even if all our exosome products are registered as a cosmetic at this moment, but the facility that we are producing our products are GMP aligned, compliant, which means normally in GMP facilities, pharmaceutical products and medical device products are produced, but we are manufacturing our exosome product in GMP facility. And we have invested to this facility 31 million US dollar for this. And in this facility, we have been developing a pharmaceutical levels of exosome, like IV injection level exosome, and something related to medicine and drug. I mean, which is our final roadmap. Our final roadmap of Excobio is, to be honest, not staying in the aesthetic market only, but going to the pharmaceutical market in the future. And number three and four, personally, I believe it is the most important question to ask whenever you met any kind of exosome product in your market. As you already know, exosome is a kind of new thing in the market. So to convince our clients and convince our patients or doctors, the scientific fact and scientific data is the most critical thing to persuade them, right? So scientific publication and scientific patent, we have the number of publication patent, 27 and 72, is the highest number among all exosome companies around the world. So I think it is very important. And number five is efficacy and safety. We have launched ASC brand in 2018. So it has been already 6 years, and we have been generating more than 1.6 million clinical cases uh, from more than 50 countries around the world. And I haven't been reported any serious adverse events so far. So, which means that our ASC products has great efficacy and safe too. And Excobio, as a dedicated company to exosomes, we have various sources of exosome. Uh, the first one is human adipose stem cell exosome, which is our main, and plant, I mean, a rose, otherwise something else to penetrate the market where human-related ingredients are not allowed in the market. And also we have animal exosome, microbiome exosome, and engineered exosome as well. And quality and purity is, I think it is the same thing in the with the question number two. And stability, we chose lyophilization for the stability. It is the same like Botox, botulinum toxin. It is a very conventional and proven method to guarantee the safety and stability of protein based material. So we also chose lyophilization for the stability and registration. Uh, for the human adipose stem cell exosome in United States, it is registered successfully in PCPC and in ICID. And for the Rose exosome, as you already know, it is already registered successfully in the CPMP portal, which means in legal point of view, there is no legal issue to use it in the clinics. And customers, we have more than 15K customers around the world. And this was the table generated at IMCAS this year in Paris. And this table was not generated by us, actually from IMCAS scientific board member. The purpose of this table was to deliver the right message to international doctor for them to choose the most reliable products and safest products in the market, because they already knew that exosome market is very muddy, and they cannot guarantee the every exosome products in their market. So they created this table. So they compared a few criteria, number of article related to product mentioned, review paper, characterization, something else. So they nominated six exosome companies around the world, and of course, Excobios are in it. And Doma Aroma, an Italian company, also nominated, and Anti-Age also nominated. But when you see the numbers, most of them are one or zero or none, which means they are not that ready at the for the science data. But on the other hand, Excobio has comparatively very higher number than other nominee, right? So this means that IMCA scientific board members are acknowledge that our products are the most safe products around the world. So this year, AMWC Monaco, our intimate product, IRV, was awarded as a best regenerative aesthetic medicine product. And also the same year, AMWC Monaco, our post-care products, Exobalm, also awarded as a best cosmetic. For your information, last year in Monaco, our hair product HRLV was awarded as a best cosmetics. So we have 3 trophies so far. So maybe next year, uh, I hope we got another trophies for skin SRLV. Um, I believe some of you guys know about this player, Manchester United player, Rasmus Holland. He posted on Instagram post, which is he was suffering from the acne skin, and Dr. Roche in UK, he treated him with our products. So with these posts, ASC got more fame than before. So let me explain the about the exosome. Exosome is a small molecule with average 100 nanometer size, which is 100 times smaller than a cell. And most of cells are releasing exosomes to deliver certain message to another cells by packing some important message in their exosomes. And basically, exosome is not a living cells, so it is perfectly safe, and there's no need risk to convey certain DNA related information to another people. And interesting thing is that exosome has a similar characteristics with the mother cells where they released from. So we need to look very careful about the source where the exosome released from. Uh, as I mentioned, we chose stem cells, and we have two versions, human adipose stem cells and rose stem cells. And for European countries, we are selling rose stem cell exosome version because they are not allowing human ingredients in cosmetic. So this is the stage of obtaining purified exosome. ExoSCRT, we usually pronounce this ExoSCART or ExoSecret. This is the name of the patent of we have. This is a filtration technology. In the first stage, we cultivate a cell to obtain cognition media. And by ExoSCART technology, we do the filtration twice. During the first stage of filtration, we are filtering the particles which are bigger than exosome, which is, I mean, bigger than 1 nanometer size. During the second filtration stage, we are filtering the particle which are smaller than exosome. In this way, we are obtaining the purified exosome only, average size between a 100 nanometer size. So this is the condition media. In condition media, of course, there is an exosome, but concentration is very small, which is 0.1% to maximum 0.5%, which is very small. But it is a fact that condition media is containing exosome. That's why most of condition media products are doing marketing activation like they are selling exosome products because it is fact in certain way. But the concentration is very low, and seeing that other ingredients, there are many impurities together, like medium components, unknown factors, and antibiotics, and cell debris and waste. So there is actually huge risk when we treat condition media as it is to our patient. There is a high risk of uh, adverse events can be occurred in to the patient. So as I mentioned, by filtration technology, we are filtering the exosome only to guarantee the safety and efficacy. So the main effect of exosome is two things actually. One is regeneration, and the other one is anti-inflammation. So we look inside our exosome to see what exactly the ingredient inside. So we found that there are 400 kinds of lipids and 600 kinds of microRNA and 1,000 growth factors in our exosome. And they are responsible for many things related to regeneration and anti-inflammation. So that's it. From the stem cells, they are releasing exosomes, and we isolate exosome only from the clinician media, and when our exosome is delivered to the wounded cells, it repair the cells, and if when our exosomes are delivered to the immune cells, it down regulates the immune level. Okay. So this is the reason why we need exosome. In a single day, we lose and replace approximately 50 to 70 billions of cells. But unfortunately, as we are getting older and older, the ratio of replacements is getting lowered. So we need supplement from outside, which hopefully be our exosome products. You may know the magazine, Elle, which is the very famous aesthetic magazine around the world. And there was one article which title was "Bigger Than Botox." When you see the in the PubMed, the number of scientific publication conducted with botulinum toxin is 25K. Even if the botulinum toxin in aesthetic market has been more than 40 years, right? And by the way, exosomes, the number of publication with exosome is 31K. So it is already exceed the botulinum toxin number of publications. So we hope exosome market could be bigger than Botox in the future. And our brand name is mentioned in this article, AC Plus. So yes, in aesthetic wise, we have already developed a product for skin and hair and intimate area, and we are now developing pharmaceutical related products for lung and intestine and kidney. And this is a mode of action. So each part has related patents already. And by regulating these kind of pro-inflammatory cytokines like PN, like interleukin 1 alpha, 1 beta, interleukin 4, something like that, we down regulate inflammation. That's it. And we also increasing elastin and collagen as well. And this is a GMP facility that I mentioned at the first slide, the 10 question. And this is located in the South Korea at the rural area. And this is the world's first and largest facility for only exosomes production and R&D. And we are producing injectable grade exosomes and by lyophilization. And that's it. We already invested for this facility 11 million US dollar last year. And this is a picture of facility. We are doing every stage from cell culture and purification, and we do fill finish, and we do our own quality control. As you can see here, it is too much for cosmetic, aren't they? So because our final roadmap is going into the pharmaceutical market, that's why. And so I can say our exosome materials and our exosome products might be the world's the most safest products, I promise. And I said, as I mentioned, we have several types of exosome, and human adipose stem cell, root stem cells, micro exosomes from microbiome, engineered exosome, and we do have a canine exosome to improve canine dermatitis. And this is why we chose uh, rose among various kinds of plant species. The most important thing is that size and shapes of rose stem cell exosomes are very similar to human stem cell derived exosomes. And rose stem cell exosomes are also very effective in human dermal fibroblast purification, anti-inflammation, and collagen production. And the most important thing is that number five, microRNA, which is the main ingredients to perform the anti-inflammation procedure. And the types of microRNA in rose stem cell exosomes are very, very, very similar with the human adipose stem cell exosome. So we believe that is the main reason why our final, the finished results of both root stem cell version and adipose stem cell version are similar as a result, clinical result. And another interesting thing is that um, root stem cell exosome was found to stimulate the exosome's release of human skin and stem cells. So it is similar with treating human adipose stem cell. And this is a uh, article of the potency of regeneration of our exosome by increasing the level of elastin. And this is the latest. Oh, already two. Okay. So this is the latest update. This is for therapeutic potential of mesenchymal stem cells for acute lung injury, which means we are going a step and step forward to the pharmaceutical level. Let me explain fast about the competing products in the market. So actually, exosomes, there are so many exosome products already in the market. There are synthetic exosome, so-called synthetic exosome, blood exosome, and animal-derived exosome, something like that. And I I can say more than 90% of them are just condition media, or exosomes are not contained at all. So I brought some ingredient. My tip is that I always advise our partners and international doctors when they encounter a certain exosome products in their clinic, please see the backside of the package to see if exosome ingredients are written. So this is a fruit, uh, so-called fruit exosome. But if you see the backside of the products, there's no exosome written. Rather, exosome extracts, something like that. So they are selling expensive juice, to be honest. And there are a few more exosome, so-called exosome products in the market. This is a VTech and this Purazome from Italy. And even if they are claiming they are selling exosome, but there is no exosome ingredients name in their package, which means maybe some combination of growth factors and something like that. On the other hand, on our products, we are clearly mentioning the rose Damascus cellular extra vesicles, which is exosome. And those are, as I said, for US market, human adipose derived mesenchymal cell exosomes are registered in PCPC, and rose Damascus cellular vesicles are registered in CPMP. That's why in all our products, exosomes are written. And this is skin products and hair products. This is an intimate products. And this is post-care products for Exobalm. Uh, Sorry for my delay. I already passed 5 minutes more. Thanks. Thank you for this is end of my presentation. Thank you.
Thank you, JB.
And I will give Dr. Elina for her to share his slide. Okay, Elina, I made you a host. Please share your PPT.
Can you see my slides now?
Yes, great.
Yes.
Perfect. So hello, everyone. I'm Dr. Elina Theodorakopoulos from Athens, Greece, and I'm delighted to be here with you today to speak about exosomes and medical aesthetics. Let me just see why this is coming up to my screen. Sorry. So I'd like also to thank Cure Medical for inviting me today to this wonderful webinar. So this is me. So I'm a dermatologist licensed to practice both in Europe as well as in Dubai. I specialize in regenerative aesthetics. I have my own clinic here in Greece called Pretty You Dermatology Clinic, and I'm a visiting dermatologist at 1111 Aesthetic and Dermatology Clinic in Dubai. I hold a PhD on psoriasis from the University of Manchester, while my supervisor has been Professor Chris Griffiths. I had a wonderful time in the UK. I love facial ultrasound as well as research. So I carry out a lot of research protocols on regenerative aesthetics in my clinic. So before we speak about exosomes, what are they, how we can use them in medical practice for aesthetic purposes, let's see where our patients are coming from, where our clients are coming from, what are they into at the moment, what are the trends, what they want, and how we can please them with the treatments that we give them. So at the moment, everything is about being very demure. So we are in a beauty era that everything needs to show natural, perfectly natural, without showing what we have done, what skincare we have used, and what cosmetic treatment we have done in the doctor's office. And how this translates actually, what our patients wants to improve is skin health, skin quality. And this is a study, a questionnaire study carried out in Canadian as well as US patients, consumers of skincare. And what they said, what they wanted to improve so that they have a more youthful skin was mainly pigmentation, dark circles, acne, large pores, skin quality, sagging skin. That's why for them, it's all about glass skin treatments that we hear all about social media, cloudless skincare, and radiant skin results. So this is to them natural looking, healthy skin of all ages and of all types. And this is another questionnaire study carried out from cosmetics design so that according to different ethnicities, our patients want different things. So when we're talking about natural skin in an Asian patients, what they want to improve is their skin dullness. Skin dullness is very important for them. So which translates into improving oiliness, acne, and photopigmentation. About the European patient is all about sensitive, thin skin, redness, and hydration. About the Middle Eastern is all about improving sun protection, hydration, and if possible, improving photoaging. And about the US patient, it's all about anti-aging, prejuvenation, and improving photopigmentation. And according to the social media and the big magazines that we have, they tend to link all these natural results that our patients want with potentially the use of exosomes. So at the moment, the exosome use either in skincare routine or at the clinic with clinical treatments is a very big thing for our patients all over the world. So what are the exosomes actually? So exosomes are extracellular vesicles that they are crucial for cell-to-cell communication. They are very important for intercellular communication, and they are thought to have regenerative properties as they carry bioactive messages, proteins, microRNAs, and growth factors that when they target the skin cells, they enhance skin repair and skin rejuvenation, while at the same time, they can reduce inflammation and pigmentation. So actually, macroscopically, what they can do when they're absorbed from skin cells is that they can improve skin texture, skin health, skin sagging, pigmentation, and erythema. What about the academic world? So this is a publication where we see what's happening all over the world with regards to the interest on clinical trials, clinical cases all over the world. So we see at the moment that everybody all over the world is interested on carrying out clinical research or experimental research on exosomes. And the most important field of those studies is mainly aesthetic medicine and skin disease. So it's more than 30% of interest on exosomes on these particular fields. And there's another interesting slide. So Evaluate is an online website with that is curating medical research reports from leading publishers all over the globe. And here what we see is that by 2030, we will be having a 10% increase in the exosome skincare interest. And that's important because at the moment, the companies that they are the stakeholders as ExoCobio that we will be talking about the product today. And the applications of those exosomes is facelift, skin restoration, and anti-aging. And this is a figure that I've drafted and is published on a recent publication that I've published on ASJ Open Forum, that these are the current sources of exosomes with experimental and clinical research supporting their safety and efficacy. So what we have at the moment in the market is human-derived exosomes as well as plant-derived exosomes. And we know that in Europe, we're not allowed to use human-derived exosomes for aesthetic purposes or skin disease. So we're only allowed to use plant forms. And I believe in the plants because plants, they don't have the bias of the human beings. And at the same time, they're more homogeneous in the results. And they can be used from patients that they don't want to, in their daily life, use anything that it has human or animal. They are coming from human or animal source. So I believe in the future of plant-derived exosomes. Let's see why. So this is the AC Plus that you're using in your clinic. We have in Europe, both for the skin and the hair. And there is also a product for the intimate area that we're not going to be talking today. So the SRLV for skin, it comes with 2 vials. And why this is important, I find this fascinating. So one vial has the lyophilized exosomes, but the other vial has a dilatant. Why we need the dilatant? So the dilatant is not just a simple dilatant. It has hyaluronic acid. It has micronutrients, it has vitamins, it has growth factors that both together with the exosomes, they mimic the microenvironment of human exosome when it's uptaken by skin cells. So we have a perfect microenvironment that we need for those cells to be activated in 2 vials for the skin. While for the hair, we have only 1 vial with the lyophilized exosomes, but all the important ingredients like active hair ingredients and growth factors, they are in that 1 vial, again, to mimic youthful, younger, thicker hair. This is the Exo Balm. This is a unique cream-based post-care formula. This is the first cream-based with lyophilized exosomes that came out in the market all over the world. And to me, it's important. We have our fresh lyophilized exosomes mixed in a cream-based formula that can help us fight pigmentation, improve skin barrier, and soothe the effect of our treatments in the clinic. And in total, it can reflect a daily nourishing microenvironment for skin cells to thrive after our treatments. So we give the exosome information in our clinic, and then we continue the message of that treatment we did, that peripheral treatment at home with our patients doing their own home care routine. I find this beautiful. And as JB talked previously, for me, as a clinician, before trying any exosome product, because exosomes are the future, I want to be part of the future, but I want to feel safer as a clinician. So I always have the 7 pillars of selection of my products. What is a cell source? What is the purity? Is it declared? Whether this is a GMP manufacturing facility that is producing these products, the preservation, efficacy, and safety. Do they have publications, patents? Are they registered just in my country, or do they have registration all over the world? And for the SRLV, for the AC Plus from ExoCobio exosome, the exosecret process is very important. So how these exosomes, they are produced in their GMP facility is important. Why? Because they undergo a double filtration, a double tangential flow filtration, like vaccinations. So what happens is that most of the debris, most of the apoptotic bodies, the hormones, the antibiotics, everything that I don't want to have in my end product, they are removed with this double filtration. So we are talking about, if you go to the GMP facility, you can see that we're talking about most of the 85% of the products is discarded, and the end product is so pure that it has exosomes inside. And then the next step is that though that end product is undergoing specific analysis, so mass spectrometry, NTA, genomics, so that they identify whether the end product has the markers, has the receptors that they actually label those exosomes. And what we find in the exosecret exosome, we find anti-aging and prejuvenating factors, anti-inflammatory and antipruritic properties, as well as wound repair and skin barrier repair receptors. And this is a slide from another study that is important to me. It mentions, of course, the exoCRT, that is a patent and disclosed process of producing exosomes from ExoCobio, but look at the slide, what it says to us. It says that almost 38% of producers of exosome products, they don't declare the isolation method, the way that they produce their exosomes. And I find this disastrous. We need to know so that we are aware whether the product we're using is the future or is not safe. And again, 35% is using another way of producing exosomes, which is the ultracentrifugation, which of course it's low cost, but it can damage the activity of the exosomes and the integrity of the exosomes, while it's only based on the density and the size of those nanovesicles. So actually, at the end of the day, we don't get exosomes as the target is just nanovesicles. Exosecret exosome is lyophilized. Why this is important? Because according to the literature, lyophilization is a safe and effective method for preserving the integrity of the lipid membrane of this exosome that carries important proteins. And this is benchmark data, published data, experimental data on the safety and efficacy of the exosecret exosome. And with regards to the Rosa damascena, I put the publications for the Rosa damascena stem cell-derived exosomes, because this is what we're talking today about. They are found to increase the elastin and the collagen significantly, so they improve and ameliorate the extracellular matrix. So the bed base of the skin, which is the dermis, it's improved, is becoming thicker and nicer, so we improve the skin texture, and at the same time, it targets and decreases significantly melanin and inflammation. So we have a therapeutic trifecta here that the target is a youthful skin appearance. Are they registered all over the world? Do we have data that is not just the Europeans that respond, but other ethnicities? Yeah, they are registered all over the world with millions of cases from different ethnicities, from different backgrounds, from different ages, and with none to minimal side effects. So this is my safety also backed up data to use that product. Do we have publications? Again, based on the review articles that we have at the moment on exosome studies, although there are extensive experimental data, there are very few with regards to our field, the aesthetic medicine and the skin disease. There are very few clinical publications, clinical trials, clinical experiments on exosomes in general. And up to more than 65% at the moment, they are based on the ExoCobio product. And these are studies that they are non-funded. Here, I put the studies, the clinical studies on safety and efficacy of the human-derived exosecret exosome, improving the skin using the CO2 laser, using non-thermal microneedling or topical application. While for the rosy gamma skin and stem cell-derived exosomes, we have similar results, similar clinical and experimental data on how they can improve the skin. Actually, the efficacy and safety, they're similar to the human exosecret exosome, and that is very fascinating. This is another figure that I've designed for you so that you understand a little bit how the exosecret exosome works. So when it's released from the stem cells, it's uptaken by the skin cells, is non-toxic to the skin cells according to the publications that we have on experimental data from ExoCobio. So it's purely absorbed, fully absorbed from the fibroblasts, the melanocytes, from the inflammatory cells, from the keratinocytes. And what it does actually to its cell, it's here. So in this slide, so it can regulate the melanin synthesis at the level of the melanocytes, as well as the melanosome function, and hence it can decrease hyperpigmentation. While finally it can improve angiogenesis, which can lead to epithelial regeneration. This is a slide that I always put when I talk about exosomes, because at the end of all my talks, there will always be a question on PRP. So PRP, we have been using it for a long time. It's fantastic, but we need to understand that there are no standardized clinical trials, clinical research that standardizes the PRP results. There may be good results due to the fact that the machine was good, the technique was good, the amount of PRP was good. So nothing is standardized in the literature, but according to many meta-analyses, we need to be careful how we use it, because the results and the efficacy of the PRP, they are depending on the gender and the age of our patients. So if you're a female and you have advanced age, it can be more inflammatory. They're anti-inflammatory compared to exosomes, which to me, they're standardized, they're readily available, they have a product standardization, and they are inherently anti-inflammatory. And here now, so I'm showing you my different protocols that I have with exosomes, with the AC Plus exosomes to improve skin health. So this is the ExoShine protocol that is also published, a recent publication that I carried out in the ASJ Open Forum published in August 2024. And this is a protocol with thermal or non-thermal microneedling at up to 1 to 1.5 millimeters of depth for different indications. And then I apply topically the SRLV with a gentle massage, and then I use my SRLV facial soothing mask with a red LED UV light for another 20 minutes. I do 3 treatments spaced apart approximately 1 month. And this is the patient satisfaction according to questionnaires that I give my patients. And the adverse events that they have reported is mild redness, mild itching, mild edema that they are resolving within 24 to 48 hours. The indications that I have is that any kind of pigmentation like melasma, post-inflammatory hyperpigmentation, periocular pigmentation, as well as solar lentiginase. Acne, scars, oiliness, skin health, they're very important also indications. And these are some photos of the ExoShine protocol in Caucasians as well as Asian patients that they wanted to improve the photoaging and skin texture. This is another patient, is a very important case, also published last year in the ASJ Open Forum. This is a Bert Hoogdebeb patient that tried the ExoShine protocol to improve skin health. And this is a publication. And this patient actually, with the exercise protocol, we were able, first time in the life of this patient, to improve the way that those follicular fibromas of this genodermatosis were coming out in the face, and they were creating irritation, itching to this patient, and a very dull skin. So this was a successful treatment for her, and the results have been sustained for a long time. So she hasn't had any follicular fibromas for a long period of time. This is another published patient with melasma, recalcitrant melasma, with other treatments that she tried the exercise protocol, and she got beautiful results. Another patient with post-inflammatory hyperpigmentation after laser hair removal. Again, the exercise protocol, very good results. Another patient with melasma and periocular hyperpigmentation, trying the exercise protocol, beautiful skin texture, beautiful results, very natural, minimal downtime, minimal side effects. An Asian patient with a burn on the face after trying a religious cleaning of her aura with steam. And she tried the exercise protocol, she loved it, and she continued at home with exobalm to just maintain the results. She's very happy. This is another protocol that I have for difficult cases. So when it comes to very thin, sensitive skin, photo aids with erythema, rosacea, especially the Caucasian white skin, or any treatment that I want to do around the eyes or the perioral area, I do the exopriming protocol. And what is this protocol, and what's the idea of the exopriming protocol? So if I want to treat those patients and I want to do good for them and I want to improve this, like static wrinkles on them and the pigmentation, I need to go deep when I do my treatment in the clinic. But we know that there may be most of the adverse event compared to good to these patients, like hyperpigmentation, a lot of downtime. So in order to avoid these potential side effects, I prime the skin of this patient with the information that I will be giving them during the clinic. So I've decided to do my laser with my exosomes. I give them 2 weeks to 4 weeks prior to the treatment, the exobalm, which is an exosome-based cream. So they apply the exobalm twice daily, especially in the areas that we will be doing the treatment. Then I do my treatment in the clinic. I don't go light. I go as it's needed. I do my AAC plus post-treatment, and then I continue to prime the skin of that patient at home. So they receive significant information of exosomes prior to the treatment, at the treatment, and after the treatment. So I get optimal results, minimal downtime for these patients. So this is the exopriming protocol, difficult cases, photo-damaged thin skin, deep skin scars, burns, post-surgical healing, like with facelift or any kind of healing that you want to, to achieve in these patients. Also, I have tried it in difficult cases like lupus and eczema, psoriasis, and vitiligo. And these are some of my patients. So this is a patient that she wanted to improve several things in a little amount of time with a very thin, sensitive skin. She was reacting to every single cream she was using at home. We did the exopriming protocol, beautiful results, no pigmentation, no post-inflammatory pigmentation of any of the treatments we tried in the clinic. And she is here having beautiful results and loving her skin. Another difficult patient with very thin photo aid skin. She has done multiple treatments in the past with lasers, and she didn't like the effect that she was getting post-inflammatory hyperpigmentation all the time. And this is here after the exopriming protocol. She loved it. She didn't have any downtime and no post-inflammatory hyperpigmentation. Another patient that she wanted to balance a lot of things, premenopausal, very thin skin. We did the exopriming protocol. She felt very youthful, very nice skin texture, no side effects. Another patient with acne and scars, she was suffering from lymphocytic hypophysitis and inflammation of the pituitary, and I couldn't treat her with any kind of medications or anything else for the acne and the scars. So we did the exopriming protocol. She got beautiful results, very good skin texture, although the inflammation, the pituitary was going on. Another patient with lupus, severe lupus, she was in extras, 18 years of lupus. She was flushing. She was under many kinds of treatments. She decided to stop. We tried the ExoShine protocol, the exopriming protocol. She loved it, and she was able to perform as an actress without having any pain, itching in her face when she was applying the makeup. And this is the ExoFix protocol that I have. This is a very simple protocol that I have for patients that they want very quick treatment, pre-wedding treatments to shine of the skin, for jet lag recovery of the skin, for patients that they don't like needles at all. And this is a simple red light UV light of 20 minutes with the SRLV face mask, as well as ExoBulb at home. None of the adverse events. Patient satisfaction 100%, very quick in the clinic. They love it, and they can do it every 2 to 4 weeks' time. This is a patient that she was suffering from post-COVID inflammation. She was tried several corticosteroids, topical and oral. She was flushing all the time for the past month. We did the ExoFix protocols 3 times, and she loved the results. She improved 100%. Another patient with severe rosacea and photoaging. He didn't want to do any injectables or energy-based devices. We did the ExoFix protocol. He was very happy with the skin texture that he got. He loved his skin. Another patient with severe burn after a hair iron, we did the ExoFix protocol, and she didn't have, first of all, post-inflammatory hyperpigmentation. She sued the results because she was in pain, in agoniating pain, and we sued the results, the pain within like a daytime after the ExoFix protocol, and she loved the result. Another patient with a jellyfish sting, she was beaten and she was given IV cortisone. She was given topical cortisone, and the rash was coming up after 2 to 3 weeks. We did just the ExoFix once, and she sent me a photo and she told me, "Doctor, I don't know what you did, but this was amazing for me." We even improved the post-inflammatory hyperpigmentation of the jellyfish sting. With regards to hair, because we will be talking about hair today, the ExoCoBio product, the HRLV, is published with good clinical results and experimental for hair growth. So I have the hair ExoBoost protocol here for you that I'm doing and carrying out to men and women in my clinic. I do it for androgenic alopecia, for any kind of alopecia, also autoimmune alopecia, scarring alopecia. I have used different kind of patients with this product, and all of my patients, they get beautiful, thick, dark hair. So with regards to patients, especially male, that they're bald, or a female that they're quite like, they have a large area of hair loss. So I do thermal or non-thermal microneedling, 0.5 to 1 millimeter of depth, and then I massage gently the HRLV that I mix with bacteriostatic saline. But due to the fact that my diluent is bacteriostatic saline, which is actually an injectable product, when it is for very difficult cases like fibrosing alopecia, alopecia totalis, alopecia areata, female patients that they have a lot of hair and they don't want their microneedling, I do a no-label injected HRLV because again, my diluent is saline, and I never had any problems with my patients for the past 3 to 4 years that I'm using this technique. I always do red light after the treatment, and I ask the patient if possible to continue the red light hair helmet at home. We can talk about 5 to 10 treatments spaced apart 4 to 6 weeks time if we're talking about severe cases, but even from the first treatment, you can see wonderful results. Again, adverse events, either with the thermal, non-thermal microneedling or the off-label, is mild erythema, mild itching, mild to moderate headache, especially the ones that they first did the treatment and they're a little bit stressed, not in the second treatment, and then mild pain that all resolve within 24 hours. And these are some cases of mine. These are women with AGA. Here, the first few pictures that they have improved. They have strong, thick hair. This is a male here in the middle down that they got very good hair. And another patient that she was 75-year-old with no hair for all her life. And she grew this thick, dark hair immediately after the HRLV. Then again, another clinical cases, women and men with beautiful hair from androgenic alopecia. Here on the left down, we see a patient with fibrosing alopecia. It's not the fact also that she lacks hair, but the skin where she lacked the hair, it was very thin, fibrotic, and red. And when we did the hair-based treatment with the HRLV, the skin became again skin. It was magnificent, fascinating. She felt her skin again, apart from the fact that she grew hair. And again, another male patient, very happy with the results. I hope you enjoyed. This is me, and I'm very happy to receive all your questions. Thank you very much for your attendance.
Dr. Elina, thank you very much for doing that for us. I really appreciate it. If you
My
ever
pleasure.
consider coming back to UK, please come to us. We'll be happy to have you. Adopt
I
you
love
over
UK.
here.
I love you guys. I've missed you.
We'll definitely
Very
invite
happy.
you over to some maybe conferences. We'll check your diary. I'll send you a message. That'd be great.
Thank you very much. It's my
JB, take
pleasure.
it from here and we do some Q&As, I guess.
Yes.
Okay, again, thank you for your great lecture, Dr. Elina. It was really, really helpful as usual. Now, we will move on to the interactive Q&A sessions. If anyone has a question, please feel free to unmute your microphone and ask. Is there any questions?
Yes, please. My name is Alpha Paulina. I'm a doctor. And I'm just wondering, Dr. Elina, you mentioned you've used off-label injectable for the scalp. Have you used the off-label and through injection to the skin also?
Sorry. Yes, I've used it through the skin, of course, injectable.
Yeah, so you can use both of them off-label. You tried both as off-label,
You
both
mean the
products?
skin, the SRLV, the SRLV. So the
SRLV.
SRLV, and again, I'm here just to teach you the on-label. It's very important to talk about on-label. So today we're talking
Yes.
about on-label. The only thing that I put the off-label for the hair is that my dilutant is bacteriostatic saline, which is accepted to be injected. With regards to the dilutant for the skin, is not injectable. It's a specific dilutant from Exacobio that is not patent as injectable. So I don't inject. And today my purpose is not the off-label treatments, it's the on-label. So I can get beautiful results with the on-label treatments. But again, I'm very happy to show you all my expertise on the Exacobio product, off-label and on-label, in a future conference that we will be doing, okay? But again, I spoke only for the off-label today for the hair, because my dilutant is something that I can inject. And I have my powder and something that I can inject, nothing more.
Okay. And with regard to the difference between adipose tissue derived and rose stem cell derived, you said efficacy is similar of result. Is there head-to-head comparison in wound healing and anti-aging?
Very good question. So very good question. So the study that I have just published on the AHA Open Forum this August 2024, actually it shows it's a clinical trial that was carried out on female women with hyperpigmentation and skin aging and photo aging issues, that I applied a similar protocol that like the one that was carried out from a Korean group on the adipose tissue stem cell derived exosomes from Exacobio. So my results compared to that study, they're very similar. But at the same time, I have my personal clinical experience on the case of Bert-Hogg-Dubé. So with the Bert-Hogg-Dubé patient, so when I first tried the Exacobio product, it was on human adipose tissue. So I got results and published with the human adipose tissue. And then I continued with the rose stem cell derived exosomes, which actually those results I will be presenting in RAS now next week. So both treatments, they got the same satisfaction, the same results, the same minimal side effects from a patient very difficult, that their skin is so difficult when you apply any kind of energy-based device, any kind of injectable. So I would say with justification and assuredness that the results, they're similar. And of course, in the future, there will be carried out studies, more comparable studies comparing them. We need to understand that plants, they are the future for us in multiple ways, but there are very few companies like Execobio that they treat them with the human adipose tissue exosomes. The process that they carry out to produce those exosomes, they're like the human ones. And this is very important because we need that technology in order to make sure that whatever is coming from nature, it's actually something that it can be not good for us. So this technology for me, it has similar results with the human ones, not only for that case that I have from Bert Hoek Dubai, but also for my cases that I get from Dubai. So for example, all my clinical patients in Dubai, they have human adipose tissue exosomes from Execobio tried. So there we can use only the human-derived ones. And my Greek patients, they get the rose exosomes. I've never had any different results, any different satisfaction from those patients, and I'm really happy about that. So
Okay.
a lot of experience.
Thank you.
Doctors, I'm Doi Kim from the Execobio. I'm a sales director of Execobio. I mean, let me reply some more to you regarding to kitchens. Actually, in terms of SLV, as well as SLV, the whole products, whole ingredients, it is medical device grade, because the regulation of each country is totally different. Like in case of like Lebanon, they can inject, legally, okay. But in case of Europe, we registered as a cosmetic, so it has to be topical application. But as a manufacturing process, we made it medical device. Even whole ingredients is a medical device, and that's why the second vial, which is diluent, there is no preservation because we made it a whole medical device just in case it can be injected to according to their regulations. So some of the country it is allowed to inject even though it is skin and hair. But still in Europe, strictly, we need to stick to regulations. For the doctors and for our distributors and for our manufacturers. So I can say, about this fact to you. Okay, and I hope this it helps you understanding about the product. And second questions about the comparison study. Well, actually, within a week, we will have a big event in Seoul. It is called RAISE, our Regenerative Aesthetic Exosomes Summit. It is happening in Korea. So Elina, of course, and other doctors, around like 300 doctors are coming. And interestingly, there's one study from the Canada right now. Apart from that, Elina and also Dr. Diane and some other American doctors, they are doing the comparison study between human and rose. At the moment, just one study was done by Canadian doctors. So there was very interesting, actually. According to Canadian doctors' study, within a few days right after the treatment, and soothing effect, which is anti-inflammations and redness, the derived exogen has faster result. Okay, in terms of redness and soothing effect, right? But within a month, which is the Elina has explained that we have a trifactor efficacy, which is elastin synthesis, and as well as collagen, and of course, inflammation, I mean, anti-inflammation. The whole process, it is depends on the skin turnover, which is 29 days, right? Which is 1 month's time. So with the total overall efficacy we can see, I mean, we can see within a month. So within a month, the rose exoderm and human exoderm product has equivalent efficacy in the end. But we found that within like 2 to 3 days, within a short period, human-derived exoderm, it gives a more faster result. Okay, the reason why we understand that, we choose rose exoderm. I mean, the JB has, explained clearly about why we choose a rose, right? Because we're screening whole, the plant-derived exoderm from the plant archive. And we picked rose exoderm because we found that rose stem cell-derived exoderm is the one which stimulates our own body's adipose stem cell to make exoderm better. So this is a chain reactions. We call it indirect reaction. So that's why we choose it, right? So we understand this is kind of an indirect reaction to give us equivalent efficacy, but it takes a time. So if we are using the human things, the whole efficacy we are expecting from the adipose, the stem cell, it is happening right now, right? According to our papers, in vitro, ex vivo, I mean, clinical study. But rose exoderm gives the same things, but it takes a time in that way. So that's in the end is the same, but reaction I think is efficacy is the human is faster, but we have to stick to the regulation anyway, right? But
Yes.
that efficacy point, but safety point is really important anyway. So that's why JB has emphasizing that we need to check this is isolated. I mean, this is the purified exoderm only, not a conditioned media, right? In terms of the safety. So that's why human or either the rose, it has to be isolated exoderms gives the safety. We can guarantee the safety. Yeah, I hope it makes sense to you.
Yes, thank you.
That's why I produce the exopriming protocol. So you can prime the skin with the rose exosomes prior to something that you will be doing that it can have a great result for your patient. So at the end of the day, you have the same efficacy and the same result.
Any more questions?
Hi, it's I'm not sure you can hear me, Dr. Tina Solomon from Dr. Benesvar.
Yes, we do hear you. Please.
Yeah, I have a question regarding the safety of the exosomes. So we talked about the efficacy both with the adipose and the rose. There are some older papers and some recent ones, not too specific, about the propagation and acceleration of cancer tumor cells with exosomes. Do we have any data on that? Do we have any data of in a population whether there's an increased incidence or those who, let's say, families who are prone to cancers? Because that's one of our major concerns, particularly with human-derived exosomes, which of course we're not using. And there's a paper from Cancer Science in 2018 which actually demonstrates how exosomes do propagate cancer cells. So it's a question mainly for the team and for Eleni.
Okay. First of all, as I mentioned, exosome is not a living cell, so it is not enough to deliver the certain amount of DNA-related information to another cells. That is number one. And number two is that there is a microRNA, which is some short part of DNA, but one of the exosome scientists, Jan Latteberg, a Swedish scientist, he told that the amount of microRNA in exosome, it is really not enough to deliver the DNA information to another cells. And number three is that among the types of kinds of microRNA we have in our exosome, there is a LET7B, and this microRNA is very famous for anti-cancer. So we believe there is no risk about the tumor genesis and oncogenesis. And if you have any, yeah.
Right. I mean, in addition to JB's answer, we have a publication. I think so. JB, we need to deliver the papers regarding his concern. Actually, that's the basic things that we have to make sure this is safe, right, from the beginning. So we have done, toxicology test first. So we have that papers about, if there is any toxicology the risk. And also we have done biodistribution test, okay, because just in case our exosome can, observe into the vessel and it deliver to certain, organ of our body. So we've done with those kind of publication, as like from the beginning. So, totally, well, actually, most of the exosome is filtered in the river, actually. So, but still, it is, totally safe. We have checked. And also, as JB has mentioned that we profiling what is inside of our exosomes. So we do analyze, we do realize that, we have 400 kind of lipids and 600 kind of microRNA. And also we have a 1,000 kind of a protein and growth factors too. So, I mean, some of them, it can promote, you can say that it can promote cancer, but majority, because it is not a single compound anyway. It has like a more than 1,000 kinds of whole things inside of it, like a one pack. So the most important thing is that the majority of the microRNA and majority of the protein, which has what kind of the efficacy, and most of them, it is mostly cancer, inhibitions efficacy rather than promoting cancer. So we realize that this one is, it gives a strong immune modulations, anti-inflammation, not rather than promoting cancer. But at the moment, recently we found there's two papers from the market about the clinical study that they are claiming that exogen product, it makes skin necrosis. So we found the two papers from the Thailand. Okay, so we checked what is going on, but at the papers they include they don't name the brand name, but they include ingredient list, and we realize what the brand is. I mean, what but the brand is. So even in the ingredient list, we clearly see that it is conditioned media on the ingredient list. So we thought, even though the paper saying that it is the exogen related product, it make the skin necrosis, but we found that it's conditioned media product, which is a Korean product we found exactly better with the same ingredient. So that's why we have to be cautious, even though there are many exogen claiming products, but I think I can see less than 1% is real isolated, the exogen. So you need to be very cautious about that one too.
Yeah, I'm covered. This I wanted to say, and I put the toxicology paper in my slides when I was talking about the exosome process, why it's important, and all the publications that I put. So it's very important to know the safety of the product that we're using. As I say, exosomes at the moment are a very hot topic, but who actually has an exosome, a true exosome product? That's a true question that we need to ask ourselves when we try such a product. So thank you for the wonderful question.
Has anyone else got any questions? I think that's a no. The silence.
Okay.
I think that's all the questions. Dr. Elina, thank you very much for today. It's been absolutely brilliant, really, to see you. One question I have, is there any videos that you may have or willing to create? I know it may seem like it's not needed, but when there's a lot of new clinics in UK or doctors, nurses, etc., using the product, even the basic videos such as using certain vials, mixing the product, etc. Is there anything that you can assist with, or you've already got that we can share?
Yeah, I have some, please. Yeah, I have a video with the Extra Shine protocol, and I can create more with the Exofix and the Exo priming protocol. So whatever you needed, I can do.
Brilliant.
So
I'll let JB know. That'd be great.
now that I have, I will send them to you for sure.
Appreciate it.
also,
I'll connect with you on Instagram and send you a message. That'd be brilliant.
And also that we have those kind of a similar video, I believe. I mean, like a mixing process and other some modality protocol process, which is done by Korean doctors. I mean, for sure, we will share with you that link too.
Perfect. Yeah, that'd be great. Right, guys, thank you very much for today. Really appreciate it. And I hope Raise goes really well. And then we'll see you guys at CCR. And I hope at another opportunity as well.
Thank you very much. Thank you.
Absolutely.
Thank you, guys. Have a
Thank
good
you,
Sunday.
guys.
everyone.
Have a
Take
great
care.
weekend.
Thank you.
Bye bye.
Bye.